You're listening to the OCD Stories podcast, hosted by me, Stuart Ralph. The OCD Stories is a podcast dedicated to raising awareness and understanding around obsessive-compulsive symptoms. I do this through interviewing inspired therapists, psychologists, and people who have experienced OCD. Welcome to the OCD Stories. And welcome to episode 374, and in this one I got on Dr. Jeremy Peterman. Jeremy is a licensed clinical psychologist and co-director at the Marin Center for Anxiety and Behavioral Therapy. In this episode, we discuss what is emetophobia. Is it a phobia or OCD or both? He gives plenty of client therapy examples. We discuss trauma and emetophobia, the worries and compulsions that go along with this phobia, the treatment of emetophobia, acceptance and commitment therapy. Jeremy gives a lot of exposure and response prevention therapy examples. We discuss values, disgust, shame, and self-compassion, and much, much more. And as you know, NoCD partner with us on the podcast, and they've recently done another collaboration with Howie Mandel. So I've pulled the audio with their permission, and I'm going to play it for you now. And if you want to find out more about NoCD, you can click the link in the episode description.
Some personality quirks are really funny. Like, I talk to my left foot more than I talk to my right. You know what's not funny and not a personality quirk? OCD. Although the term OCD is widely recognized, it's misunderstood by most people. It doesn't mean being tidy or clean. It's having obsessive fears, thoughts, and urges. You question your character. You question your safety. That's OCD. Breaking the OCD cycle takes effective treatment. Go to nocd.com to learn more.
So that was the new advert with Howie Mandel. If you want to watch the video version of that, you can head to NoCD's Instagram account. And thank you to all of our Patreons for supporting our work. This podcast episode is available as a video recording on our Patreon and includes bonus questions to my guest. To sign up to our Patreon and to check out the other benefits you'll receive as a patron, please see the link in the show notes. So thank you to you guys for your time and for listening. I deeply appreciate it. And thank you to Jeremy too. Welcome to the show, Jeremy.
Thank you for having me.
Yeah, it's good to have you here. So today we're going to talk about emetophobia. But I guess before that, maybe just if you want to introduce yourself and anything else you want to share about you.
Yeah, well, like I said, thank you so much for having me. It seems appropriate to be talking about throw up on St. Patrick's Day, which is what we're recording today. But I'm a clinical psychologist. My practice is just north of San Francisco, and I've been working with kids, teens, and some adults for the past decade, treating anxiety disorders. But I've noticed, I would say since I went to graduate school, I noticed a great need to work with patients with emetophobia. I remember as a young graduate student, I was all ready to treat kids who were afraid of dogs and afraid of the dark and heights. And then I just got this slew of people who were afraid of throwing up. And I was trying to find resources on it. And at the time, there were no treatment manuals. This was back in like 2010. There were very few websites on it. So it's always kind of been an area that's intrigued me and seems like there's a great need. And now when I get calls from patients and I tell them this is something called emetophobia, that's something that provides them a lot of relief that they're not alone in having this.
Yeah, I like that. Yeah, absolutely. So what is emetophobia? Let's start there.
Sure. Well, at its core, emetophobia is the fear of throwing up. But it's a lot more nuanced than that. You can have two people with emetophobia and it can look quite different. There are different causes and there's different manifestations of it. So for example, you can have someone who has a more social anxiety flavor of it and they're scared to be out in public. They're afraid that they're going to throw up in front of other people or they're not going to make it to the bathroom on time. So they have to change their routine. They might not eat out at restaurants. They might not want to go on an airplane. Whereas you might have someone who has more of a panic disorder vibe to them, where it's the fear of the physiological sensation. It's all of the anticipation of when am I going to throw up and what's this feeling in my body and what does this mean? And still, I know this is an OCD podcast. There's an OCD version of emetophobia where people have intrusive thoughts about times they've thrown up or stories that they've heard. And that can also produce a cascade of physiological sensations. So, again, you can have two different people, but very different experiences of emetophobia. And I think one thing that's really tough about it is something that follows you around. It is the enemy within. It's not something that's so easily avoided, and it can be very impairing.
And of course, and no matter how much you try, at some point, the thing you fear is going to happen. If
Mm-hmm.
you, maybe that's very triggering for people, but I don't know a way of stopping that. I guess if you get a viral illness, there's a good chance you're going to
Mm-hmm.
be sick. Or, well, I guess if
Mm-hmm.
you've got emetophobia, maybe avoidance of drinking, so you're not going to necessarily be sick because of that. But I guess it's
Mm-hmm.
one of those things I guess you can't stop forever. Is that fair to say?
Yeah, you can't. Throwing up is just part of the human experience, and you can try as much as you can, but it's a fool's
Mm.
errand because at some point it's going to catch you. I'll give just kind of a quick
Yeah.
personal anecdote. I have a sensitive stomach, and I was traveling abroad and got food poisoning a few times, and I was determined in this recent trip. Just, I'm not going to get food poisoning. I'm not going to get sick. And I went to India. And so
Mm.
I TripAdvisored every single restaurant ahead of time. And I found like in the reviews, throwing up, food poisoning, sickness. I was just determined. And still I got sick there. And still I threw up. And this is not a caution tale against India or anything, but it was like a 2 hour discrete period. And what a waste of time that was to do that. And disclosure, I don't have emetophobia, but you just, you can't prevent it. You just really can't. And oftentimes when we're sick, we don't even know the source of the illness. We can't go back and say, oh, that's what gave it to us. And now I've learned from that. And now I'm going to avoid that. We might think we can, but we can't.
Good point. Good point. Good story. So you kind of answered it a minute ago, but the question I had was going to be emetophobia. Obviously, phobia is in the name, but I haven't
Mm-hmm.
treated a great deal of young people with emetophobia. But those I have,
Mm-hmm.
it just feels
Mm-hmm.
very much like OCD. Everyone I've ever heard talk about emetophobia, in my mind, I could just say it's OCD. So I guess the question is, phobia or OCD, or is it, as you've already kind of said, maybe a combination?
Yeah, I think both exist. At a practical level, I don't know how much it matters. The treatment is very
Yeah, of course.
similar either way. Um, I would say people who are more on the OCD end, of course, have more intrusive thoughts. Um, I, I'll give you an example. I have a girl that I'm currently working with now, and she is afraid that if she's exposed to stimuli associated with vomit, she's going to get thoughts about throwing up in her head. So she's afraid of those thoughts.
Mm.
And as an example, she is doing some classic OCD behaviors like hand washing and so forth. I had another girl who fit a little bit more on the OCD end who she was on an airplane. She was wearing a particular dress. She threw up. Uh, that dress was yellow. Now she can't wear anything that's yellow. And
Mm.
so there's some contagion superstition around it. Versus there are some people I see that don't have as many of the intrusive thoughts outside of the window of contracting the stimulus, but when they're put in the situation, then all of a sudden sort of they get into acute fight or flight. So I think there's more of a pervasiveness to it when it's more OCD versus kind of in the moment, the fear.
Mm. Yeah, good answer. And Eva, I guess clinically for you, how much you see it, and maybe you see it more than other therapists because you're maybe selling yourself in that way. I don't, niching yourself, I should say, or niching. And versus, or do you know the actual sort of data on it? We know OCD is like 1% to 2% of people, depending on what study, but is there any data on
Mm-hmm.
emetophobia?
There's not a ton of data. I will say from what I've read, I've seen 0.1% of the population. I think that is very low in terms of what I see. And I don't necessarily advertise myself as a emetophobia clinician. They just somehow come and find me. I would say in my case, when I treat across the spectrum of anxiety disorders and OCD, I'd say at any time, 10 to 20% of the people I treat have emetophobia.
Mm.
The percentage of people who have some fears of throwing up where it might not reach the clinical threshold is obviously much higher than 0.1%. But like I said, I think it's not super well studied. I think a lot of people don't even know the name emetophobia. So I think it's out there much more than we think it is.
Yeah. Yeah. I mean, outside of my clinical practice, I know quite a few people I've met who, whenever there's this idea of throwing up, they get really anxious. Maybe they
Mm-hmm.
don't meet the diagnostic criteria of emetophobia, but but they're already anxious about it. So yeah, I think it is a larger number than we think.
I think
And
so.
get ready after this podcast. Your caseload is going to be a way higher percentage of emetophobia.
I'm okay with that. Yeah.
Okay, good. Yeah, okay. And I guess I wanted to ask a question around, I'm using the word trauma loosely here, but from what I've seen, a lot of cases sometimes have had, I don't want to say traumatic experiences, but emotionally tough experiences in the past with being sick or being around people who were sick in a quite embarrassing way or scary way. And then that may have triggered them, or maybe they were sick in a place that was embarrassing, or just they weren't comforted in the right way when they were, because being sick is quite a scary thing, especially as a kid. So is that I guess, yeah, how much do you see that where there has been these past experiences versus there's no real rhyme or reason why this person's worrying about it?
That's a great question. I certainly see both. And I know we're kind of using lowercase t trauma when we're talking about it, but there have been instances. I'm thinking about a particular client that I saw where she was in a car ride and someone next to her threw up, and they were on the freeway and she couldn't leave and she had to sit with it. And that was, you can imagine, even without someone with emetophobia, that would be a pretty gnarly experience. So you often do hear kind of story zero of where it started, but there certainly are people that can identify it, and they might say, I haven't thrown up in like 8 years, but perhaps they heard a story, their parents told them about the time that they threw up, or they read a book about throwing up, where there was a character who threw up, or that the school taught something around throwing up. So it doesn't necessarily have to be a personal anecdote in order to develop this. Usually it starts in childhood, and kids are predispositioned to anxiety. And so this is something that the anxiety lands on when there is a particular experience. Interestingly, most people I've worked with with emetophobia don't regularly throw up. And I don't think that's a coincidence. I think that, again, there might have been an instance way back, whether they experienced it directly or indirectly, and then over time that story started to get bigger and bigger and bigger in their minds, and their minds added different details, and their minds kind of switched up really how terrible it was. And so it becomes its own entity that they're now afraid of.
Yeah, that's true. And the less you do something, in this case, the more afraid you're going to become, because you're just avoiding it, right? And the brain's learning, this is dangerous, this is scary.
Exactly. And a big part of emetophobia is anticipation. It's sitting with nausea or other physiological symptoms and not knowing if you're going to throw up, where you're going to throw up, how bad it's going to be. So whereas they might not have recently thrown up, surely they've recently had some uncomfortable physiological sensations with ambiguity. And every time they encounter that feels very terrifying.
Yeah, really good point. So the next question I had, and I want to frame it in an OCD lens, just for my listeners. So whether it's OCD or not, emetophobia, or falls into it sometimes or not, if you were to describe, if we were talking about a theme of OCD right now, I might ask you, what are some of the common obsessions with this theme, and what are some of the common compulsions? And I think we could use that language here, right? So what are some of the common worries people with emetophobia are truly worried about? And you have mentioned some already. And then also, what are some of the compulsions or safety behaviors they're doing to avoid, I guess, throwing up?
Well, I look at it through a cognitive behavioral lens. And I think in terms of worries, like I said, I think there's a lot of anticipation, uncertainty. I think there's a fear of how painful it's going to be. There's a fear of associated physiological symptoms with throwing up. There can be a social anxiety component. Behaviorally, it manifests in so many different ways, through reassurance seeking, checking, avoidance. There are some obvious things like avoiding sick people. Kids who know that another kid in class is sick might not want to go to school that day, and there can be some school refusal. Or when they're in school with that child, they're constantly keeping an eye on that kid or keeping their distance. Kids or adults might be masking, which is complicated because that's more socially accepted than it was in, let's say, 2018, but they're not doing it because of COVID. They're doing it because they can protect themselves. In terms of additional compulsions, there's definitely compulsions around food, checking foods, avoiding certain foods that they might associate with throwing up. Checking expiration dates is a really big one, and not trusting themselves and their senses to eat foods, but they have to really follow the precise date. A lot of people are afraid of being stuck somewhere, because they won't be able to escape in case they have to throw up. So a lot of people avoid uh, uh, going on airplanes. I had one client years ago who was afraid of getting married, which is scary for many reasons. But he didn't want to be stuck up there and have to leave in the middle of it to throw up. And as we talk about treatment, we ended up doing an exposure where we simulated a wedding for him, which was kind of fun to do. Uh, you know, these are people who, I mean, gosh, they could go to great lengths and completely change the course of their lives because of it, where they might not want to have children because kids throw up, or when you're pregnant, you might be nauseous. And then again, some classic OCD compulsions like hand washing, showering, sort of things around contamination OCD.
Okay. And yeah, the kid thing, that's what came to my mind. So I'm glad you said it about people may on the extreme end avoid having kids. Because yeah, kids do throw up in a big way. I've
I can say that from personal experience.
Yeah. I've been thrown up on so many times in the last few years. And now I'm habituated to it. It really doesn't faze me. The first time it was my anxiety shot up massively, not because of more the germs that have been, covered in stomach, whatever. Okay, so let's talk about the treatment or the therapy. So I'll leave it broadly initially, and anything you want to say on that.
Yeah, so it's similar to other types of anxiety disorder therapies, but there's some unique things about it. I would say before we jump into the exposure, we'd like to start with some psychoeducation. You want to know how the machine works. You want to know how your body works. You want to know how anxiety works, because that can be empowering and less scary. So I explain to people, this is how you throw up, and this is why you throw up. Your body senses or your brain senses there's something not going right in your body. It releases adrenaline. You start to develop physiological symptoms. And by the way, it's a sad irony, maybe not an irony, but when we're scared of something, our body is kind of a chameleon. It takes on the thing we're afraid of. So if you have panic disorder, your heart beats really fast and you think, oh gosh, that must mean I'm having a heart attack. Or if you have a phobia of choking, you have that lump in your throat. So people with emetophobia often have a lot of false alarms, with nausea and dizziness and heat in their face. So it's really hard to know if it's going to happen or when it's not going to happen. But like I said earlier, letting them know if you don't have a history of throwing up when you have those nausea symptoms, you're probably not going to throw up. So that's the one bit of reassurance I'm going to give you for the rest of this therapy. But again, teaching them how it works, that the muscles between your neck and your abdomen contract. That puts pressure in your stomach, and that's why the food shoots back up from your stomach. And I apologize if that's triggering for anyone. But your body has thought this whole thing through. You're not in any danger in this moment. Your body has thought it through in the sense that it closes the tube into our lungs so we don't choke on or throw up. And that's why you take that big gasp of air before you throw up. You're sweating because it's trying to cool you down. Even the saliva that you might have when you throw up, it covers the enamel in your teeth so the acid from the throw up doesn't erode it. So we need to trust our body that it's doing something actually to protect us. Another part of treatment is thinking about how do we tolerate that uncertainty of, am I going to throw up or am I not going to throw up, and that cascade of physiological sensations. I often use the metaphor of it's like riding this, rodeo bull that's trying to throw you off. All these sensations are being thrown at you, and anxiety is trying to get you to compulse or seek reassurance or whatever it is. But we have to find a way to just sit with these sensations without doing that, which is incredibly hard to do. And one little trick around it is to just neutrally name the symptoms rather than spinning judgment on it. My heart is beating faster than usual, period. There's a lump in my throat about the size of a dime, period. My body's sweating, period. Just see it for what it is, but not through the goggles of anxiety. Now, this next tactic I'd use a little bit more for the phobia rather than the OCD, but sometimes we ask ourselves, would I bet on this? Would I bet in this moment that I'm going to throw up? I ask kids, like, what's something that you really care a lot about? And they say, oh, my cell phone, or oh, my iPad. Okay, well, let's put your money where your mouth is. The next time, would you give me your iPad to take the bet that you're going to throw up or not? And usually they say no. That's not meaning that they're giving themselves 100% certainty, but they're using the context clues to say, maybe this is another false alarm. Or another way to put it is like, imagine that you were listening to this weather person and they say today, or tomorrow there's going to be a rainstorm, and you're like, oh, I guess I'm going to cancel my plans to go to the beach, and I guess I'll sit at home all day. And then of course the next day it's sunny and you're like, oh, that weatherman. But okay, let me tune into him one more time. Oh no, tomorrow is really going to be the storm. I got that wrong. And then the next day it's sunny, and you can see where this metaphor is going. That's what it's like when your brain's telling you over and over and over again, you're going to throw up, but you just don't. At what point are you going to fire that weatherman or tune into another channel? And then just a couple other things before we get to the exposure is trying to prove to yourself what you can do despite your nausea feeling. Your world doesn't have to shut down. It's not going to serve you well to just sit and ruminate and guess whether you're going to throw up or not, because you don't know. So what can you do in the meantime? You can probably tell I practice ACT. I like a lot of metaphors. And I think about it like if you're going to the airport and you're waiting for your flight, you can stare at that board all day long and see when, the flight status changed from delayed to now boarding. Or you can go and shop around and go to the news shop, get a coffee, but then periodically check back to see if your flight's there. So when I'm telling people to do something else, I'm not saying it to just distract yourself and deny that you're feeling that way, but don't let that anxiety take over. Do something else. And then, I don't know, every 20 minutes, come back and check in. How's my body doing? Have I thrown up? Have I tolerated this? Has the nausea been a 10 out of 10 the entire time, or has it fluctuated? Okay. All right, back to what I need to do. I'll pause there because we can talk a lot about the exposure element, but those are some of the things I'd like to sort of get into place before we jump into exposures.
Yeah, I'm glad you went into that. And yet sometimes act like things can help make exposure, in my opinion, easier on the person or more tolerable. So I like what you said about naming, my heart is beating, period, or faster than normal, or like, so yeah, I'll do that a lot with thoughts. So I'm having a thought about killing someone, for example, as opposed to getting hooked on that. So it reminded me of that, like that diffusion of just trying to get yourself a bit separate from the experience, or just keeping it as it is and not letting it get into something bigger with our imagination.
Exactly.
Okay. And will you wait until you really feel people have got those skills in place before moving on to exposure, or will you kind of teach them it and then go into exposure knowing that they'll keep learning it anyway as you go through it? That makes sense.
I take it on a case-by-case basis. It's a great question. And, it always comes down to their willingness to do the work and their willingness to experience uncomfortable physiological sensations. I think exposures for people with emetophobic OCD or emetophobia is a lot. And something that's unique about it is emetophobia packs this 1-2 punch of emotions. There is the fear element, of course, but there's also disgust. And disgust is a tricky emotion. I mean, evolutionarily, we know disgust is there to keep us safe. If we, eat, cave people, you're eating that poisonous mushroom, you want to have disgust. But disgust happens even before you eat it. It can come from seeing it or the smells from it, again, to prevent you from being in a hazardous situation. So now you have two incredibly strong emotions that are telling you to do everything but the exposure.
Yeah.
You are fighting against millions of years of evolution. And by the way, we know that there's some research that shows that disgust takes longer to habituate. So even though the anxiety might come down, the disgust might persist. So before we jump into exposures, again, I need to make a really good case for why it's worth tolerating your nausea. Because nausea is a very unpleasant feeling. I've had intense nausea in my life. I've had intense pain. I'll take the pain any day of the week. I'll be honest. I would. So we need to make sure that people are really willing, and what they mean they understand by willing is I'm going to feel this way. I'm not going to know if I'm going to throw up or not, but what I do know is I'm taking steps to reclaim my life, and that's worth it to me. I can
Mm.
move forward and make a decision rather than anxiety making a decision for me if I want to eat in public, if I want to go to school, if I want to have a child. Those are big decisions that should not be left to my emotions.
Mm. Yeah, absolutely, absolutely. And I didn't know, well, what you said about disgust. I didn't actually know that it kind of takes longer than anxiety to habituate, which makes sense now. I think about my clients. The clients with disgust and OCD, it does seem to take a bit longer than when it's purely anxiety. Um, yeah, okay, that's useful for me to know. But yeah, you mentioned there kind of or alluded to values. At what point will you bring in the values work? Is that early on, or is that? I guess it is early on, right? Do you explicitly talk to them about values in that sort of language?
I do. It's going to look different whether I'm working with a kid, a teen, or an adult, but
Mhm.
I, I think that's something that cuts across all therapies. I think values have to be discussed immediately, and I've historically thought of that as a shortcoming of CBT that, um, and such a welcome addition from ACT that it's so focused on symptom reduction, and a lot of people call clinicians for symptom reduction. I don't want to feel anxious anymore. I don't want to feel disgusted anymore, and we know that one, we might not be able to 100% impact that. And two, that's not the point of life. I
Mm.
think this comes out of ACT, where no one puts on their tombstone, I was really good at not being anxious. That's not what we want to be remembered in our life for.
Mm.
Um, so they need to, it's great to work on symptom reduction, but there always needs to be a destination that we're going to carry them through these really difficult exposures. So if you know that your North Star is, I want to have kids, I want to go out more with my friends, I want to go to bars and drink, um, great. Now we have a destination that we're going to versus aimlessly wandering through a sea of exposures. So
Mm.
I think the earlier the better.
Yeah, really, really good point. So let's talk about ERP, exposure and response prevention. So they've got the skills in place, they know their values, they know why they're doing this work and where they want to head. Um, yeah, anything you want to say? I mean, a lot of my audience, as you know, will be familiar with ERP, but anything you want to say from a emetophobia perspective of how you,
Sure.
yeah.
Yeah. Well, I'll give some examples and as I mentioned earlier, this is one of the reasons I really like working with the Emetophobia because there's a lot of opportunities for creativity. And I would say the majority of my work is with kids and teens. And this might sound strange, but sometimes with these exposures, I've actually had kids come in the following week and say, hey, can we do that exposure again from last week? That was really fun. And I know that might sound crazy, but there are ways to kind of make this engaging. So, first of all, just saying the words throw up, puke, vomit can be very triggering.
Mm.
Um, and sometimes that's just where we have to start, just by saying the words or reading the words or writing those words down. Um, I have a girl that I'm working with right now, and she could not tolerate it. When I would say the word throw up, she would curl up in a ball and like hide in her mom's lap. And it's like, yeah, we got to start here. And so finding ways to make it fun, like with her, I say these words in a terrible French accent. So I'm like, puke, vomit, throw up. Or we use this little app called Voice Plus, where you can change the voice. And some of this comes from ACT, into like a Darth Vader voice or an alien voice, helps to raise some levity to it. And then you can slowly transition from there to now saying it normally again. Because what happens again when you say that is, for this girl, the physiological sensations then immediately come. Her heart beats fast, her stomach turns, and then her brain is saying, "Up, that means you're going to throw up." So, yes, we're exposing her to the words, but really what we're doing is exposing her to the sensations that she's having in her body. Oftentimes, then we move up to pictures and videos. Um, and there's different ways to do that. With pictures, I might start more with cartoons and then work my way up to more graphic pictures. With kids, I play Vomit, Go Fish, and we have little Go Fish cards. So I say, "Do you have the chunky yellow vomit in a bag?" No, go fish. Um, we also sometimes play guess what the person ate by looking at the pictures, which works twofold. One, it's silly, but two, it forces you to look at the details of the picture versus avoiding. And with the videos, there's ways to manipulate it as well. So if it is really overwhelming to watch the video, first you can freeze frame it so it's a picture, or you can speed up or slow down the playback speed, which again gives people just need some sense of control as they do the exposure. For some people, sounds can be very triggering. And of course, there's sounds that you can find online, but a big part of this particular fear is the uncertainty if and when someone's going to throw up. So I'll have parents, or if I'm working with an adult change their cell phone ring or their text message to a throw up sound so they don't know when it's going to happen. For those physiological sensations, we pull from the panic disorder literature and do interoceptive exposures. So I had one college student who would spin around while eating tiramisu. I don't know why he chose tiramisu, but that was his exposure food of choice. And certainly that produced a bit of nausea. I have some VR head goggles where kids will watch videos of roller coasters while they're eating. So again, that produces that physiological sensation. And then there's some panic and, oh no, I'm feeling nauseous right now. I'm like, great, this is an awesome opportunity to ride that wave right now. Let's ride the bull. We're not going to let that bull kick us off right now. Now, any therapist who regularly treats emetophobia has a recipe for vomit, to make their own vomit. And I'll just share with you, cooking with Jeremy and Stu today. My recipe is cream of mushroom soup, beef soup. I put some oats in there, some blue cheese, and the secret ingredient is let it sit in the sun for 2 days. So it's pretty gnarly.
Yeah.
Yeah.
I'm feeling nauseous.
And
yeah.
Sorry about that. But then we bring it into the session and we practice like throwing it up into the toilet. I might leave some of it on the street and encounter it. I will say that with some younger kids, I have used a little bit of deception and somehow convinced them that this was real throw up. Coincidentally, my office is next to a GI clinic. So I say I'm able to get some samples, and that does produce more powerful exposures. I can go on and on about these exposures, but you can see that we're trying to tap into all different sort of sights and sounds around throw up with the ultimate goal of tolerating the sensation, tolerating the uncertainty around it. I will say in doing all of these exposures, I have yet to have a kid throw up in my office.
Yeah, important point. Yeah. Yeah.
Mm-hmm.
And look,
you're still thinking about the vomit recipe.
No. I was No, I've tried to put that out of my mind. No, I've accepted it that it's there, and I'm making space for it. But I'm glad you said, no one has in all this time has actually thrown up. But I was going to say, and it wouldn't have been the end of the world if they did, because then you were there to help soothe them, calm them, and hopefully give them a new healing memory, so to speak, of, okay, I did throw up, but actually it was in a very loving, caring environment that I was held and contained. And that may have been quite healing in and of itself. So
absolutely. Yeah. Absolutely. It's the same thing. It's very akin to panic disorder treatment. If someone has a panic attack, that's not the end of the world. And that's not the goal, is to prevent all panic attacks. The more we try to fight it, the more likely it might happen. So you said it beautifully, that our goal is to reconstruct the narrative of what it means to throw up. That, yes, I'm not selling this as something that I like to do on a Sunday in my free time. I don't want to throw up. But if I do, I can take a moment to pause, recognize my strength in getting through it, recognizing that actually I get some relief from doing it. I actually might feel a little bit better. And asking myself, what have I learned from this experience that I can tell to my future self when I'm feeling this way again?
Yeah, good point. I loved all those exposure ideas and the detail you went into each one. You didn't just reel them off. So I like what you said about, obviously, the VR goggles. I think is a great way of making it fun for kids. And then that's going to pique their curiosity of just maybe they've never used VR. And now they're more focused on that then. And also with the looking at the images and getting them to notice things of what they ate and how that's, again, piquing their curiosity. It's engaging a different part of the brain, right? And then what was the other one that I really liked? You said I'm forgetting, but yeah, there was a lot in there that was really good. Um, okay, and any case examples you can share about treatment overall, not necessarily in terms of success stories, or maybe success story, but more just how it went and what you did, or if there are any sticking points or anything you want to add from a treatment perspective.
Sure. So again, I'll just because it's fresh in my mind, I'm working
Mm.
with a girl, so I don't know the end of the story here, but she had a pretty severe fear. She actually had a prior OCD diagnosis before I met her, and she was deathly afraid of going into school because her mom had, this is let me rewind here. This is a 9-year-old girl. Um, she was very afraid of throwing up, and her mom had become her safety figure, and there was compulsive reassurance seeking where every time she had an uncomfortable sensation, Mom, am I going to throw up? Or I look a little pale. What does that mean? And Mom, with the best of intentions, would answer that for her. No, you're not going to throw up. It's okay. And then she would feel better. And the problem was that at school, there was no point person that could replicate the sense of safety that she felt with her mother.
Mm.
And so she started to encounter these sensations at school to the point that she was now going to the guidance counselor's office on a regular basis, who also provided her reassurance. But then it got to the point where she was just refusing to go altogether. Mom would report that there were these 3-hour battles in the morning, that she was just too scared to go to school, wouldn't even get out of the car. So you can imagine this was incredibly impairing for everyone.
Mm.
Um, So some ways that we worked with it, one, we had to work really closely with the school and have sort of someone that she can go to, at least as a short-term accommodation, and work to just get her back for part of the day. But we really had to nip the reassurance seeking at home ASAP. So, the classic of you already know the answer to that. But with kids, you can be a little bit irreverent and you can just say banana, or every time they seek reassurance, the parents would tell her like a riddle or a joke or something like that. Again, to add a little bit of levity to the situation without giving that reassurance. Um, we had to work with the parents to come up with a very strict behavioral plan where we want to be certainly very empathic to her struggles, but at the same time, it's not okay to miss school. We
Mm.
still have to go to school. And for now, we will kind of accommodate not doing as intensive schoolwork. That's okay because the main goal is to get her to school, but you've got to go to school. I can confidently say that she is now going to school and there's no battle in the morning, but she still has a lot of lingering emetophobia. So now we can work more tactfully on those exposures. Um, I recently, in our recent session, shared with her some stories that I found online of people throwing up. And interestingly, and maybe this is where some of the OCD comes in. She said, that was scary, but it would be much scarier if people in the room would tell me their stories because it feels more real, like I'm going to somehow get sick from them, even if their stories are from the past. So
Mm.
last week we played a game in the room where me, her mom, and dad all wrote our own personal vomit adventures. We put them on index cards. We mixed them up. We each, told a story, and she had to guess whose story it was. And if you could fool everyone else, you got a point. So again, ways to kind of make it fun and engaging. Um, this is not the same case, but I worked, I have someone sort of on the back end just wrapping up therapy, who again started with masking all the time, not able to eat in front of other people, because she was afraid she would contract germs, to now
Mm.
she's doing totally great. But I had a volunteer come in and again, used a little deception and said that he is able to make himself throw up. This is
Mm.
working with a 7-year-old. And this poor volunteer, he's a psychology student in a nearby college, but I gave him a little Tropicana orange juice and said, we're going to sit outside and you're going to pretend to throw up. But what was cool with her is I said, you're going to give him the thumbs up of when you want him to throw up to give her control. And you can stand wherever you want. And she stood probably 100 yards away. She could probably barely see him. But I said, when you're ready, you give him the thumbs up and he's going to throw up. And within just one session, it was so powerful, like having that control that she was able to then sit next to him. And she thought this was real throw up. she was able to sit next to him, mask off, and it was really cool. And I'll say that because emetophobia is so tangible, and again, there's so many creative ways to work with it, it responds really well to treatment. I would say people really can get over it. Yes, they're still going to be a little bit queasy when they're exposed to cues associated with throwing up, but the amount of impairment can drastically go down, especially when you work with kids when it first emerges. It's really cool to see a lot of changes.
Yeah, that's really cool. And thank you for sharing the case examples. A question that came to my mind actually after what I said before is I was like, I really like that you get them to notice the detail in the photos. And then what you were saying there about as a family and with you were writing stories on index cards, mixing them up, reading them out. I can imagine there's some therapists listening. And I understand why you do it. And I do that too. As in, but I can imagine they're thinking, hang on a minute, that's distraction. They're not actually sitting with the exposure. Anything you want to say on that? Because there's some traditional ERP therapists that are like, no, stay with it. Don't think about anything else. Sit with the exposure.
Yeah, hardcore OG exposure therapists. Yeah, I know the type. Again, as someone who works with kids and teens, that ain't going to cut it.
Mm-hmm.
That's just not going to cut it. And when I was in the room in that specific example with that girl, she was experiencing the fear. It wasn't all fun and games. There was a time, after the first story where she's hiding, she's like, I'm done. So you still can very much elicit the anxiety in a way that doesn't have to be that hardcore. Mm-hmm. And I think that the proof is in the pudding that even with this method, I see people habituate. I see people, which it's arguable if habituation is even the active mechanism in exposure therapy. That's a whole other conversation. And I see people able to get back to their life. So it is a little, I can see that point. It's a little bit of distraction, but realistically, that's to ask anyone who's experiencing that much fear and that much nausea to just sit with it. For a subset of patients, I think that would work. But for a lot, I think that's just, you're going to have to give a spoonful of sugar with the medicine here.
Yeah, good point. And I look at it as it's not distraction for avoidance sake. It's distraction for refocusing on your life. So, so when my clients leave the room and they're triggered, I want them to be able to refocus on their life, whatever they're doing. And it's not avoidance. They're doing it for a different reason, which is to live their life. So so in therapy, when we do an exposure, I'm okay doing that. So we do an exposure, right? Let's now tell me about your week. What's the school project you're doing? And I'm purposely distracting them, but they're engaging in their life, which is the conversation with me, which is how we live our life. Because when we're triggered at work, we're not then going to sit there and ride out the trigger without doing anything. We're going to live our life, hopefully. And yeah.
Exactly right. And no amount of therapy, bells and whistles, like I said, is going to compensate for the millions of years of evolution of disgust and anxiety in that moment. They're still going to feel it.
Yeah, true, exactly. Yeah, good point. So let me think. The next question. I guess, look, there's some people that might actually be sick on a regular basis because of physical ailments or diseases they're experiencing, or like you said yourself, you have a sort of sensitive stomach where you maybe throw up more than the average person. Do you see emetophobia in those people too, where they're like, maybe they are going for a real bad disease at the minute and they are throwing up on a weekly basis, but they're now deeply probably traumatized by that and not wanting to throw up?
Absolutely. I will say that is the exception rather than the rule. Like I said earlier, most people with emetophobia don't regularly throw up, but yes, that can absolutely happen. And you can understand why they would develop that fear. It makes so much sense. It'd be odd if you didn't in some ways. So it does add a layer of complexity when someone does regularly throw up. And, obviously the first thing they need to do is talk to their medical doctor and see if there's anything from that perspective that needs to be taken care of. But then, yes, it's more of an act perspective of, unfortunately, these are the cards that you were dealt and you didn't do anything wrong. You don't deserve it. But what are you going to do with it? how much does this have to define your life versus be a part of your life? I'll just give a quick example. I was working with a college student who regularly threw up in social situations, and was not really able to eat in public, wouldn't eat in his classes, um, wouldn't even attempt dating. And when we did exposures together, that actually is a case of, I should take back what I said earlier. That's the one person who did throw up. Um, and so I think we have to first validate that and find some self-compassion for that versus let's jump and say your thoughts are irrational or let's jump into exposures. But yeah, this is really friggin' hard. Um, so what are our workarounds for that? And just using this guy's example, when he was to go out with friends, he would go to the restaurant 15 minutes early to scope out the bathrooms. Now, I know we would think of that as an avoidance behavior, but practically, when you throw up regularly, that makes sense. And oftentimes he would throw up before the other person would get there, and then he would be okay. And that was just kind of his workaround. He would also carry a toothbrush and mints and so on with him. But when I did exposures with him, when he and I, would go to this pizza restaurant once a week and eat in public, he would sometimes in the middle of our session say, "Excuse me a moment, I have to go." And then he'd go to the bathroom and then he'd throw up and then he'd come back. And again, while that was very unpleasant, he was able to find a way to go out. If I saw someone just say, "Excuse me, I need to go to the bathroom," and leave for 5 minutes, I wouldn't criticize them or judge them or even assume that they were throwing up. And so he found a way that, again, not ideal, that he was able to kind of lead his life, and work his way around it. And then once he started dating, sharing with the people he's with that this is something he's struggling with. And if they reject that, then why should I be with this other person? I don't want to be with someone who's going to reject that. And then there was a psychological element that with exposure over time, he actually did end up throwing up less, even though there was some legitimate reasons of why he was throwing up.
Yeah, really good illustration. And yeah, I can imagine just self-compassion is a big thing within those examples.
I think there's a lot of unfounded shame around throwing up. Who hasn't thrown up in their lives?
Yeah.
But this idea that if I throw up in front of other people, they're going to judge me. They're going to think I'm weird. They're going to think I'm disgusting. And I mean, put yourself in that position. And when you see someone throw up, you feel bad for them.
Yeah.
You're like, man, that sucks. And you often draw from your own experiences of, throwing up. Yeah, I don't like throwing up and I feel bad. And how can I help that person? But we misattribute what other people think of us in that moment. And it's not something we have to be ashamed of.
No. Well, exactly. Yeah, it's like peeing and pooing. We all do it, right?
Exactly.
A little bit more regularly than
Exactly.
throwing up, but yeah.
Yeah. Hopefully.
Yeah. It always reminds me of those kids' books. We always see they're always called Everybody Poos, to de-shame it for young kids. We need one of those Everyone Pukes. I'm sure there is a book like that. If not, I
think we should write that together.
Yeah. Yeah, sounds good. So slight change of direction. You pick up the phone and call the 20-year-old Jeremy. What'd you tell him?
20-year-old Jeremy about anything or about being a therapist?
Anything you want.
Oh my gosh. Let me think about that for a second.
What did he need?
What did he need? I would say to just take more risks and take more chances, which is easier to say when you're older. But I feel like when I was 20, I was pretty cautious. I feel I was a little bit shy talking to new people, shy asking people out, overthinking a little bit. And I just wish in hindsight when you're 20, that is the time to take chances and do different things and explore new places and meet new people. And certainly you can do that at any point in your life, but as you get more and more settled, it becomes less easy to do. I think when I went to college, before I decided to take a psychologist, which actually was a chance, I was really focused on what career is going to give me stability. How am I going to make money? And I was focused on, well, maybe I should be an attorney. And I interned at a law firm and I'm like, well, this is awful. And then I was like, maybe I should be a dentist. They seem to have a pretty stable lifestyle. And then I spent some time being pre-med and shadowing a dentist. And I'm like, well, this is pretty awful. Sorry, no offense, dentists or lawyers, but it just wasn't for me. And so I found that I was a pretty cautious person. And uh, actually coming into this career was a bit of taking a chance. My whole life, I had lived in this one area of the world. And when I was a senior in college, that's when I switched my major to go into psychology. And then I applied to grad school outside of Boston where I lived, and that was a chance. So I feel like later in my life, I've come to embrace taking chances. And that's something I profess a lot to my clients. And it's helpful that I've had this experience of being more cautious, because now with my clients, I can empathize and know truly how hard it is. It's easy to be the person in the big leather chair with the degrees to be like, you should just take risks. But remembering, especially when you're young, how hard that is and how it feels like everything's on the line all the time.
Yeah. Yeah. Really good point. Yeah, I'm sure there's a lot of people that could relate to that. I mean, I can, yeah, I definitely didn't take many risks. So billboard, you got a billboard in San Francisco somewhere. What do you want written on that billboard?
Wow. Billboard in San Francisco. I would say, all right, well, I'm gonna give you my sort of psychologist answer. I think it would say certainty is an illusion. I think that's what it would say. Because I don't think it just applies to emetophobia or even anxiety. I think everyone is always looking for certainty. And then it would have a big picture of my face with 2 thumbs up, and that would scare a lot of people.
Yeah, it's a valid point though, right? I mean, not to trigger anyone with existential OCD, so there's your trigger warning. But like, you know, I just assume it's pretty certain that the sun's going to rise tomorrow. But I don't know that deep down, you know? Maybe there's some catastrophic event that wipes the whole universe out. But yeah, it is an illusion.
I think I'll try to give a non-therapist answer to that. I think I would say something in a billboard about the need to travel. I feel like most of what I've learned in life that's been important has been through my travels. As a kid, my parents were really cool, and they allowed me to, they would take me out of school to go internationally, and just connecting with people from different cultures. I mean, to see how we're kind of all the same in a lot of ways, but also there are some differences. I don't know. There's something so powerful about traveling that you can't get from anywhere else. You can't get it from a book. You can't get it from watching TV. It's not the same. I just think people need to go out there and travel. I think the world would be a better place if we all went out our comfort zone into different countries.
Yeah, very good point. Very good point. Again, something that's probably easier done when you're younger, right? Just to inspire any 20-year-olds. Then again, financially, it's sometimes easier when you're older.
True.
Yeah. So, lastly, anything else you wish you could have said on this topic or anything else today?
Well, I just want to give some resources for any listeners who are suffering from emetophobia. As I was kind of researching for this podcast, I didn't realize that there was a manual that came out, self-directed manual in 2020 by Ken Goodman, who's an LCSW here in California, and it's Free Yourself from Emetophobia. And it's a pretty cool book, and it's filled with QR codes, so you can kind of go at your own pace and scan it. And when you go on that QR code, there again is sounds and pictures and things associated with exposure. So that way you're not, again, super triggered by reading this book. And again, I just want to emphasize the point that if you are dealing with either emetophobic OCD or more traditional emetophobia, that there is help out there. There is a name for this thing. There are a lot of people who share it with you, and there's no shame in throwing up. We all do it. Everyone poops, everyone vomits. I think that's a good note to end on.
That's a good title for the episode as well.
Yes.
Thank you for listening to this week's podcast. And thank you to our Patreons who helped make this episode possible. And if you would like to find out more about Patreon and the rewards and benefits, then there will be a link in the episode description. If you enjoy the OCD Stories podcast and would like to support us with a one-time tip/donation, please go to theocdstories.com/support. All tips, no matter how large or small, are greatly appreciated. Please subscribe and rate the show wherever you listen to the podcast. And thank you to NoCD for supporting our work. If you want to find out more about NoCD, head to go.treatmyocd.com/the OCD stories or click the link in the episode description. And quick disclaimer, guys, this podcast is not therapy. It is not a replacement for therapy. Please seek treatment from a trained professional. And until we speak, take care.